I got some more to let in.
And you're live.
Okay.
Great. Good evening, everybody. Thank you for joining us for our April webinar. I'm delighted to have you all. This evening, we have a really interesting presentation from Claire from the Canine Clinic here in Cork. So if you have any questions throughout, please put them in through the chat line and we'll pick them up and we'll come to the questions and answers at the end of Claire's presentation. So you can put in your questions at any stage during the presentation and then we'll get started when she's finished. So I hope you enjoy it. Claire, off you go.
Hi everyone, I'm just going to try to share my screen with you guys there. I have tested it and it has worked, so just give me 2 seconds and we'll be off. Firstly, can I just say thanks to the lads here for actually inviting me on to do this. It's my first Zoom presentation, so hopefully it goes okay. The only Zooms I've done are hens and quizzes up till now, so this is slightly different. So my name is Claire O'Donnell and I opened the Canine Clinic last year. Can you hear me now? Yeah. So anyway, there's a couple of things I want to cover tonight would be just the background, where I've come from, what I've done to get to this point, what we offer in the Canine Clinic. I'll talk a little bit about physiotherapy, hydrotherapy, electrotherapies that we use in the clinic pretty much in every session, and acupuncture. So I'll touch on acupuncture, but it's actually done by a vet. So in veterinary medicine, you have to be a vet to do acupuncture. Very unlike human medicine, but that's the case with veterinary. So I also want to go through some risk assessment and standard of care, and this is just something that I feel I have to talk about because I think that hydrotherapy and things for animals, same with kind of training and stuff like that, it's a really unregulated area, and I think more and more places are beginning to open up in Ireland, and I just kind of want you to know what a normal standard of care would be and what you should expect when you would go into a hydrotherapy clinic or meet a physio, because it is quite new to Ireland, so it's, you know, it's all kind of finding its feet. And then finally, how you'd get your dog referred if you were interested in getting your dog referred. Okay. So a bit about my background. This is a photo of Damon. He passed away about 1.5 years ago. He was 14 and a half, but he was the whole reason I actually got into working in this field. Growing up, I always was obsessed with animals, obsessed with dogs primarily. And I used to take in strays, even though my mother was terrified of dogs, but she didn't pass it on to me, thank God. So yeah, Damon was primarily the reason I got into it, simply because he was what we all say of like, he was slowing down, and I got back from traveling and I was just like, oh my God, I left like a youngish dog and now I've come back and he's old, and what can I do about it? Didn't want to be a vet, don't like the idea of opening things and cutting things open, but really like the idea of fixing things and rehabilitating things. So I was just kind of looking into that, but again, there's nothing in Ireland, there was no courses, didn't really know where to go. So from a young age, I had gone into like dog training, did a couple of courses in dog training, did my BHS exams with horses. I used to show jump quite a bit when I was younger, so I just loved being surrounded by animals. I did my work experience in the guide dogs in Cork, which is actually where Damon came from. So I knew someone in there and I was just like, look, I really want a dog. So I actually got Damon when I was 18, which is quite late to be getting a dog when you're obsessed with dogs. But anyway, so I went to Australia and I worked in seeing eye dogs over there, which I absolutely adored. And I actually got to be sponsored over there, but it just didn't work out, which is kind of lucky for me because I ended up going down this other pathway. So I got back to Cork and I started working in Galabi Veterinary Hospital while doing my postgrad cert in small animal rehabilitation. And I just absolutely adored it, loved every second of it. Couldn't believe my luck, like. And yeah, I did that for a year. My postgrad took about a year, and then I had a full-time job in Galabi and I worked there for 5 years. So going back and forth to the UK, doing some CPD, so your continuing professional development. I just loved it. Loved being in the veterinary environment as well. I learned loads working in a veterinary hospital. So I was seeing, I was able to go in on surgeries and see exactly what was coming to me and understand a bit better, I suppose, why a dog would present in a certain way, or what it would look like, or what it should look like, or even from an anatomy point of view, and just being able to see inside of the body, like, it was very fascinating. But all good things come to an end, and I just felt the need to spread my wings a bit, I suppose, and open the Canine Clinic, as I said, back in February of last year. And I'm so delighted I did it. I have not looked back since. So just another thing, I'm a member of IRVAP. It's an Institute for Registered Veterinary Physiotherapists. Something as well that when you're looking for a physio or a hydrotherapist and something, just making sure that they're part of an association so that we all meet a standard of care and standard of professionalism. So what we offer here is physiotherapy, hydrotherapy. So I got a pool, which is built in the UK, so it was bespoke. So I suppose working in a pool for 5 years, I knew what I liked about it. I knew what I didn't like about it. So the big thing for me, I'm also quite small and petite, and I get a lot of big, very overweight, old, crippled dogs. So it needs to be easy access in and out of the pool. So basically I got the ramps built with really, really gentle gradients, and most of it goes around most of the pool. So it's quite nice for dogs who are a bit afraid of swimming or afraid of not being able to stand in water. It's heated to 32 degrees all the time. So it's nice and toasty, and it's a 4 meter by 2 meter pool. So it's enough space to work on the platform, but also to do some, fancy word for swimming is free rhythmical sequencing. So to do that as well. We offer acupuncture. So a vet comes once a week and she provides that. As I said, she has to be a vet. Very newly, we're going to start offering hydrotherapy courses through the Canine Clinic. This is through a woman called Barbara Holding in the UK. She actually trained me. So she has a company called Canine Hydro Services, and she trains hydrotherapists in the UK. And now we're going to be offering it through the Canine Clinic. So it'll be the first of its kind in Ireland, which is really exciting. So it's kind of in the beginning of that at the moment. Hoping to be able to provide a nutritionist consultations as well, weight clinics, and a behaviourist will probably be coming to the clinic as well. So I just basically want to be able to offer a broad spectrum of things from the one place. Products, also a lot of stuff that I talk about in my sessions will be available to buy directly from me, rather than you having to go away and try find these things that I'm suggesting that are going to change your dog's life, So they're all going to be available in the clinic to buy as well. And finally, the thing I put in at the end is support network. And I suppose what I mean by this is I suppose being able to support, especially dogs in their final years or final year or months or weeks even, to be able to provide that support to people, I think is really, really important. I would see people maybe once a week. I've been seeing people once a week for 5 or 6 years. So the bond you create with the person and the dog is huge. So that's something that I think is really important as well, to be able to be kind of that person that can kind of say, let's take a look at things here, maybe it's time to, put the dog first, the dog always has to come first. So so I suppose, what is animal physiotherapy? Most of you will probably know, have been to a physio yourself in years. The difference between me, an animal physio, and a human physio is you probably leave the human physio thinking, oh my God, I'm in agony, or that really hurt, or whatever. Whereas with us, we're going to get bitten if we push things too much, or if we're not reading an animal's body language or dog signaling, or if we're not listening to what they're trying to tell us. So the way we approach it would be very, very different. So therapeutic handling is a big thing that we talk about in our line of work. Understanding a dog's language is so important. So what we would do on land, I would do a lot of proprioceptive work. So that's like, if you see this little guy here, he's doing a proprioceptive track. So his body awareness was absolutely terrible. He had come from a rescue in Limerick, actually. So it was just as an assessment, but also as a treatment. I was getting him walking over those. So the other things we use are the laser and the pulsed electric magnetic therapy, which I'm going to speak about in a couple of slides. Manual and massage therapies, so passive range of movement is, I think everyone's heard of that. I'm not a massive, I don't do it a lot if I don't have to. I would more so be doing active range of movement. So that's getting the dog to do all these movements, but like voluntarily rather than me actually doing it for them. Behavior modification, enrichment techniques. So obviously a lot of the time with behavior issues, a lot of it is stemming from pain or discomfort or associations with pain and stuff like that. So we will look at that globally. And then I suppose something I suppose I need to try to get across is that hydrotherapy in the UK and some hydrotherapy clinics in Ireland are literally just hydrotherapy, and that would be, you know, swimming a dog, as people think. So I suppose what I do is I use water, I use the properties of water to do physio in. So anything I would do on land with a dog, I am doing in the water, and I just find it easier. I find I can get more out of the dog. Like take, for example, dogs who don't like their feet being touched. I'm sure, Niamh, as a groomer, you can relate to that. Like they could take your hand off because they don't want their feet being touched. Whereas in the water, their body, it feels so different, and they just let me do anything. They also have the buoyancy of the water to support them, which is really important for dogs like your old arthritic dog who finds it difficult to stand on land. If they're standing on a platform in the water, they have the buoyancy of the water, you know, and it just, obviously their trust is there, they know they're not going to fall over, and I generally will give a lot of support in the pool as well anyway as the water. So that leads us on to the water-based physiotherapy itself. So yeah, so as I mentioned, it's 32 degrees. It's kept at that all the time. It results basically in vasodilation, increased blood flow, assisting in relief of muscle tension and improving cardiorespiratory output. Like these are just some of the things that it does. I mean, like a session in the pool would consist of a lot of static work. Like people think that it's just constantly swimming. It's not. So I would do a lot of work on the platform, trying to improve posture, doing soft tissue work, a lot of soft tissue work because we are in 32 degrees, which is lovely. So that helps soften the tissue for me first, and then I can go on and do a little bit of myofascial release or rhythmical sequencing or different little things that are going to help improve how your dog is moving. So it's kind of like with the posture education stuff, that's something that you can do anywhere, anytime. It's kind of simply like, even with me, like I kind of hunch over quite a lot. So if someone was to say to me, oh, you know, sit up straight, like, and if they kept saying that to you, you are going to eventually start sitting up straight. So it's the same with dogs. Some dogs are quite kyphotic, so that's kind of like hunchback along their spine. And there's reasons that dogs hold themselves in certain ways all the time because they're compensating primarily. So yeah, so that's the water-based hydrotherapy. The electrotherapies we use are pulsed electromagnetic therapy. So this is non-invasive, it's pads. So if you can see this little guy here, he actually has one under his elbow along with the laser next to his elbow. It's a fascinating tool, it's non-invasive, but basically works on a cellular level. So anything that's damaged in the body, this works to repair it on a cellular level. And it really helps with pain. We used to use it a lot in the hospital for post-op cases, but I always use it on my arthritic patients, or actually use it all the time. So basically what it does is it can relieve pain, reduce swelling, encourage wound healing, and aid in neurological cases. So this is definitely the case with spinal injuries or after spinal surgeries. It's brilliant. It's absolutely brilliant for that. The other thing we use is laser. I absolutely love laser. So with pulsed electromagnetic therapy, you know, you can't see the results. Like, you're just going based on the dog's movement or posture or whatever. Whereas with the laser, if I can find trigger points on the body and I use the laser for 5 minutes on that area, I can go back and see that it actually is now gone, you know. So it's something that is actually very measurable in a way, which is why I kind of like it. I use it primarily for tissue. It's great for wound healing, really good for trigger points, as I mentioned, nice for osteoarthritis, muscular injuries, tendon injuries, ligament damage, brilliant for pain, for managing pain. So yeah, these are kind of a couple of the tools that I would use in any one session. So the key benefits of hydrophysiotherapy, primarily to relieve pain. Initially, a lot of dogs will come to me and they're not on pain relief, or, you know, they're just really struggling. So this is a really nice way to get that under control, and then we can start to work on building muscle and improving function. But initially, if we can get the pain under control by using all these different modalities, it's really good. So preventing further injuries is a big one. I mean, people always wait to come to me until, like, the dog's really bad, whereas if we can get them in early, or as I had a vet say to me one day, oh, the dog's fine, like, he's just a bit stiff getting up and the owner is overreacting, or whatever the case may be. But sure, like, I was kind of saying, well, send it to me now when the dog's 7, rather than waiting till it's 10 and it's absolutely crippled. So, like, improving quality of life is the big thing here, and that's exactly what hydrotherapy and physiotherapy does. It improves coordination and balance, increases strength, flexibility, and range of motion, 100%. So at the start of every session, I would assess the dog, and from week to week, especially in the cases maybe they've been post-op TPLOs. I'm sure a lot of people are aware of TPLO. Every second dog seems to be getting them at the moment. So from that point of view, it's really easy to measure, like, from week to week, how the dog is doing. Again, improving endurance and cardiovascular performance. So a lot of I suppose the cases in the UK, they would be seeing dogs that do agility, like real sporting dogs. In Ireland, I don't see that many sporting dogs at all. It's primarily pet dogs and your older arthritic dogs, and anything post-op is what I'd be seeing. So improving overall psychological well-being, that's an interesting one, simply because a lot of dogs I've had, owners, you know, maybe they're lacking in confidence or afraid of everything. A lot of these rescues that come in would be kind of quite afraid of new people, afraid of, you know, different things. But I must say, like, after a couple of sessions, I've had people say to me, oh my God, like, the dog is way more confident now. He wants to go on his walks. He's not hiding in a kennel anymore. And that could be both down to because his pain is being managed, but also because he's, you know, he comes in to the clinic to me without its owner. It's achieving something that is, you know, is never asked to achieve before. And it's feeling really good when it's leaving, and feeling quite confident doing so. So everything in the clinic is very positive. Trying to get the dog on board would be a main thing for me, because obviously if I can build a relationship with the dog, it makes my life a lot easier. I'm asking it to go into a pool. I'm in the pool with it at all times. So it is really important, that relationship that we build up. So for someone to come back and say, oh my God, the dog's like, it's like a different dog, is brilliant for me. So acupuncture, can't really speak about this, but I did ask my acupuncturist to give me a couple of lines on it. So the only thing I could say, and the video here is of my own dog, Chili, who has passed away since, but she was diagnosed with degenerative myelopathy back in May, although I had seen signs since, I suppose, before Christmas, but I thought it was her hips, and deep down I kind of knew it was degenerative myelopathy, but chose to try and ignore it. And CTs showed up just hip stuff. But anyway, I was very lucky that I have my own clinic, and I got Chili in the pool 3 times a week. She had physio every day, and she had acupuncture once a week. And the biggest thing I would say from someone, I've had acupuncture once myself, I would say. But the biggest thing I noticed was her tail function. She had lost her tail function, which was really sad because she had a big fox's kind of tail and it was always going. So one of the big things was her tail function had pretty much ceased. It was very low. She had a very low tail carriage. And I started getting acupuncture on her. And within, I would say, two sessions, her tail function started going again. And I actually couldn't believe it. And I suppose from me, like obviously from wanting to see results, like that was huge for me. And I was like, wow. From a pain management point of view, it's huge as well. I have loads of clients that use it simply because their dogs can't tolerate pain relief. So as a combination of therapies, I think it works wonders. Having the hydro, physio, and acupuncture together, it's brilliant. So this is an example of how chilled out they are having acupuncture. So this is chilly. I'm not there at the time, like so. So she's using different points all along her spine, particular points that would be specific for degenerative myelopathy to help her spinal function, and she absolutely adored it. So it's just enhances blood flow, circulation, nervous system stimulation, and the release of anti-inflammatory and pain relieving hormones. I've definitely seen really good results in dogs with osteoarthritis as well. I have one dog in particular that comes to mind who was really struggling from a pain point of view, couldn't take pain relief, and responded really well to acupuncture. So it involves the insertion of needles into specific points on the body tissue where nerve bundles and blood vessels come together. These collections of nervous and vascular tissue are termed acupuncture points. So yeah, it works on energy channels and stuff. And I think for a lot of people, it sounds a bit hippy-dippy, but I was blown away by the results I got with Chile. So I would highly recommend it. This is a bit of a meaty slide, but I probably should have said, what don't we treat? So we treat everything. Big thing is people thinking, oh, my dog's too young for this, or my dog's too young for arthritis, or not using it as a preemptive or a preventative even, and just waiting for it to be a cure. So and I definitely, as puppies as well, if they are getting in and confident doing this, I mean, once a situation does arise, if they do have an injury or something like that, they're not going to be worried coming in, they're not going to be bothered about it at all. So as I mentioned before, the big ones are the geriatric dogs. It's huge. It's my bread and butter, I suppose. I would say the results with them are amazing. To be able to improve their quality of life, and actually to be able to, I have one dog that has been coming to me for 5 years, and he's 17 now, and I just think like he wouldn't be here without it. So many dogs spring to mind. I have clients, giving me Christmas cards saying, thanks for giving us our puppy back, So I suppose the big thing from that, the geriatric dogs, is if you find yourself saying, oh, he's just getting old, or he's slowing down, like, call me. Like, that is definitely a point where there's so many things we can do for dogs now. There's so many things to improve their quality of life. So yeah, definitely start looking into things if you're saying those words. Joint conditions that I primarily would treat would be elbow dysplasia or hip dysplasia. Hip dysplasia is so common. Yeah, I'm starting to see puppies younger and younger, and I've no doubt that thanks to this pandemic and the demand for dogs, there will be a lot of puppies coming, unfortunately. Neurological conditions, which I love treating, so anything spinal, it's so rewarding because seeing the improvement from week to week is amazing. Soft tissue injuries, as I said, cruciate surgery and teleluxation surgery would be the big ones that would come to me. Obesity, I mean, 80% of my clients are probably overweight. It's one of the biggest issues, which is why I am adamant to start weight clinics, because it's a free option. It's free, you can do it at home. You just need to get your dog to lose weight and they're going to be a happier dog. It's that easy. If they are arthritic, which most of them are, it comes hand in hand, then they're going to feel $1 million if they're not carrying all this weight around with them. So that's trying to support people through a weight loss program can be challenging, but it's definitely worth it. And the minute the dog starts losing weight and the person comes back being like, oh my God, they're like a puppy, it makes so much sense. And it's so rewarding for the owner because they can see the results themselves. Conditioning and endurance training, as I said, I don't really see that much of the athletic dog. That would be or in the UK, they do a lot of agility over there and a lot of work in pools with agility dogs, which is actually amazing because it's so fast moving, which is different obviously to my primary geriatric dog, which is a lot slower. And then general fitness. So for your young, older, or for your young or athletic dogs, it's brilliant. I mean, obviously, you know, it is expensive and it's not something that everyone can afford, but if you can, dogs absolutely love it. So safe practice. So this is something that I just wanted to touch on because I suppose I put so much time into, you know, being really cautious and creating an environment where your dog isn't in any danger or anything like that. And then I sometimes see videos online of, you know, dogs being hoisted into pools or some really questionable things being done, dogs on poles and different things like that. So what I would expect if I was bringing my dog to a hydrotherapy center or a physiotherapy center is that there's someone in the pool or in the treadmill at all times. And this is so that we can affect their movement, so we can improve how they move and assist how they move. I would expect that it's easy for the dog to get in and out of the pool. So if they're struggling getting in and out, I would kind of worry about that because, you know, you're defeating the purpose of your treatment. This is another big one. So I see a lot of dogs, you know, people throwing toys for dogs and things like that, and them taking them off the water line, which can actually cause water intoxication. There was a case in the UK a few years back, a devastating case where, you know, it just builds up over time. So it's just something that we don't allow. We will throw a toy for your dog if your dog is toy motivated, and we will pick it up before they get to it and we will give it to them. So this just, if they're constantly taking water, I don't want to be responsible for anything happening to your dog. So it's just not allowed. So I suppose it seems serious because it's a therapy. It's not fun swimming. It's not, you know, loads of dogs in the pool having the crack. It's serious because your dog is getting a treatment. Harnesses, your dog will be wearing a harness in the pool. There's no buoyancy in that harness. So we want them to work their core and get their core engaged. So sometimes with a buoyancy aid, they don't, they disengage their core. So as long as you're confident or the therapist is confident using a harness without buoyancy, then that's kind of where I'd be going. Hygiene. So the pool is tested twice a day. There are chemicals in it. There's chlorine in it, obviously to kill any bacteria. And that has to be within a certain level so that it's not affecting obviously me or your dog or your dog's coat and skin. And it also takes a lot of work to get a pool, you know, nice and clean and the water sparkling and everything like that. So a lot of work goes into kind of behind the scenes in a hydrotherapy center. So, and the same with the pH. So the pH has to be around 7.4, as that's your dog's mucous membrane, same level as that, so that you're trying to keep everything within those parameters. Ventilation is another big one. You don't really want to be your dog going into a room with moldy walls and things like that. And then I suppose a big one for me is dog-centered techniques and goals. So by this I mean like that at the end of the day, the dog is what matters here. Like the dog is coming for the treatment. I have one case where the dog was just really, really anxious and really wound up. And lucky for me, the dog's owner was on board. And basically I was like, I will get the dog in to the pool, but it might take a couple of sessions. So some people are like, I want the dog in the pool and I want it in now. But if that dog's not capable of doing it in the session, I'm not going to put myself at risk. I'm not going to put the dog at risk. So the dog does come first. So I worked on getting that dog up the ramp without too much stress, worked showering it, putting on the harness, just breaking it down for the dog as best I could. And on the third session, I would say, we got into the pool, no bother, the dog was calm. It was all on, you know, relatively on the dog's terms as well. Simply because he was pretty much up here, really, really anxious, where he probably could have bitten or anything like that. So something that should never happen is that we push the dog into a situation where they're so freaked out that they end up biting. So it's not, as I said, this is a therapeutic environment, and having the dog on board is what we want. So dog-centered goals, how we approach the dog is really important, how we hold the dog, it's definitely, there's a mutual respect there. So I think that's something to look for as well, is how the therapist approaches your dog, how they handle your dog, etc. So I just said I'd do a couple of little case studies, of nice case studies. This is Doris. So she was a rescued lurcher. They don't really know her history before they got her. I think she came from dog, actually, DAWG, and apparently she had never been shown love. She didn't know how to reciprocate it or anything like that. So she was quite nervous in the beginning, but really, really sweet, really lovely dog. But your prime candidate of not being able to tolerate pain relief. And she was, you know, she's an older girl, and like she has a lot of old injuries as well. So she was definitely in pain and definitely struggling. So we started her in the pool, and she responded within the first session. Straight away, she was like weight bearing better. So she was ongoing lame on her left hind, and very painful on manipulation of that or any palpation on it. But yeah, responded really well to hydrotherapy. The week later, she started acupuncture, and the combination just totally worked for her. So once she started weight bearing, we could work on building muscle. And to be honest, to look at her now, she is pretty symmetrical on both sides. So she is doing really well, really happy, playing with the other dog, and doing really well. There's actually a video of her. So this is her having her post-electromagnetic therapy and her laser, which she absolutely adores and snoozes for that. And this is a video of her. I hope you can see this. It's a video of her, just an underwater video. So what you'll see is I'm supporting under her chest, and then I bring in my hand back, if you can see that, to get her kicking off my legs or kicking off my hand to improve how much she can retract her hind limbs. So essentially, it's kind of like us being in a swimming pool and reaching for the wall. And if you can kick off the wall, you will automatically start to reach for that again. It's kind of similar with dogs. So some dogs don't retract their hind limbs that far, especially if they have hind limb issues. So really, everything we're doing in the water, we're just trying to improve function, and again, encouraging them to use limbs or parts of their body that they've been switching off due to discomfort or pain. Sorry, that's playing again. So the next little case I wanted to kind of show you guys is actually something quite recent that I worked with. So this is Misty. She had a dislocated hip. She was a rescue dog. Dislocated hip for quite a long time. X-rays kind of showed on CT, and she was operated on. But she came to me. I think she was non-weight bearing for 4 months by the time she came to me. Even after surgery, she wasn't weight bearing. So because I'm dogless at the moment, I said, look, I'll take her for the 2 weeks and see what we can do, because coming up once a week, she was coming up from Kinmare once a week, just wasn't going to cut it. I just didn't see her using her leg for a very long time, or if that was the case. So we decided to do intensive rehabilitation on her, and I worked on her every day. I think I got her in the pool 5 out of 7 days a week. Did physio on her every day, and used electrotherapies in the evening when she'd snuggle up on the couch with me, otherwise she didn't want them. And yeah, there was a point where I thought, Jesus, she's never going to use her leg. And then day by day, she just started improving and weight bearing, and she's now gone home since Paddy's Day, and she is back playing with her pals, galloping in fields, delighted with herself. So this is just a little video I threw together there last night, just with a couple of bits from the last couple of weeks. I had her for 2 weeks. So this is Misty. Take a look. the joy when she started using her leg walking down the ramp was, you've no idea. Yeah, we became besties by the end of it, so. Sorry, just get past that. So that was Misty. Like when I was in Galabi Veterinary Hospital, we did a lot of intensive rehab on certain cases, and I definitely missed that, being able to do that. So yeah, the level of like rewarding of this job is kind of, I mean, it is something that you have to kind of stick with. I think that's the difference between being a rehab therapist and maybe being a surgeon. Surgeons just go in, fix the situation and leave. And we have to be like weeks or months of like putting in all this time and effort, but the results are amazing. So I suppose, how do people end up coming to me? They start recognizing stuff with their dog. So as I said before, big thing of, oh, he's slowing down, or he doesn't want to go on his walks anymore. He doesn't want to play with the other dogs. He's very slow from getting up after lying down. Like, these are all things I would hear a lot. Noticing changes in posture and behavior, they're huge. So like being snappy, not wanting you to touch certain places. Licking and chewing would be another one. So like excessively licking limbs. Panting when they shouldn't be panting is a dead giveaway. So like in winter, if your dog's panting in the evening, like, why is that? And these are all little things that are kind of telling you that your dog is in pain. And by the time you start noticing these things, your dog has been in pain for quite a bit of time. So definitely don't ignore them. Go to your vet. Get an opinion from your vet and see what you can do to help your dog. Because what will happen is you'll start putting things in place and doing things to help your dog and realize, oh my God, he really was struggling, you know. So the faster you can nip it in the bud, the better. And just quickly, because I just done a time check and I am rambling. So just what a first session would look like with me. I get your full history from your vet. That's really important, obviously. It's kind of like putting a jigsaw together. I'll get a day in the life of your dog, go through, get an idea of what your dog's day is like, where your dog sleeps, just up and down the stairs all the time, jumping up and down off beds, etc. Then I'll do a full assessment of your dog. Start with land-based therapies, and this is kind of just to build up a rapport with your dog as well before, you know, asking it to go into a pool, which is quite a big deal for them. I will then, based on how your dog is, I will devise a home exercise plan. That way I will teach you before you leave, or send you some videos that you can see me doing it with another dog or even your own dog. Depending on the dog and the temperament of the dog and etc., I might start hydrotherapy that day, or else it will be the next session, depending. And then obviously on support and a report back to your vet once we kind of do a couple of sessions. I'll speak with your vet. And that's it. How you get referred is simply contact your vet, as long as they've been seen by a vet recently and they're healthy and they can go into a pool of 32 degrees, that their heart is okay and all that. Basically, you can fill out a veterinary referral form or email the canineclinic@gmail.com. Having a good team of people is really important. Like, so a physio, having your vet, and making sure like that we all communicate together to get the best care for your dog is something that I'm trying to strive towards with a lot of different vets. I just think it's really important, and we can just get a clear idea then of what's going on with the dog, with a specific dog, rather than me giving one opinion, them giving another opinion. And regular updates and discussions with your vet. Yeah, so just a progress, you know, from week to week or month to month, or however often you come. And that's kind of it for me. That's just a taster of kind of, I suppose, what I do on a daily basis and what we see and everything like that. So I hope it was informative, and yeah, thank you for listening.
It was really interesting, Claire. Thanks a million.
No worries.
We don't have a whole pile of questions at the moment. We have 4 or 5, but if you want to ask a question to Claire, send it in via the chat at the bottom of your screen and I'll come to it there now. But in the meantime, just before we go to the questions, our next webinar for May is on Thursday the 6th of May, and we're covering eyes. So Lisa McCall of the Pet Eye Vet Clinic is going to be doing that webinar. So I know we all have a big interest in all the degenerative diseases in the eyes and all the rest of it. So it'll be really, really interesting one as well. So on the 6th of May, we'll be covering the eyes. So just a couple of questions, Claire, we'll start off with. From Roisin, are there any exercises we can do with our puppies to help with their joints?
Loads, yeah. I mean, well, the big thing with puppies is definitely flooring. So I didn't really talk about that, but home environment is a huge thing with your dog. And because we all have wooden floors and tiles and everything, it's absolutely detrimental to your puppies as they're developing. So getting down some non-slip surfaces would be a big one. And not over-exercising your puppy is another one. I've seen loads of puppies at the moment chasing balls in fields and stuff like that, and I'm just like, oh God. But exercises, sit to stands are always a good one. If you can get your dog to do a symmetrical sit to stand and teach what when you're training them anyway, that's a really nice one because it engages, if they're sitting properly and square, it engages the core muscles, your glutes and your hamstrings, and they're the powering force of the dog. So if you can get them nice and strong when they're young, that's simple exercise to do and to work on. Use it like a human squat, so nice and fast, quick sit to stands would be the easiest, most effective exercise.
Okay, great. Would hydrotherapy help a 10-year-old toy dog who has developed trouble with slipping patellas?
Yes. Anything joint related, if we can build up muscle in the pool, because if they're not able to do that much exercise on land, then we can get them depending on the muscle rather than on the joint. It depends on the grade of the patella, but obviously if they're managing it conservatively, then physio and hydro would be part of that treatment plan. Yeah, for sure.
Great. How many sessions on average does a dog need to attend?
Yeah, that's a good question. Every dog is different, but generally what I would try and do is 1 a week for 4 weeks. Now, everybody's different. Some dogs are insured, some aren't. Some insurance companies cover all the hydrotherapy, some don't. So as a general rule of thumb, just to get the dog used to it and to get the best out of the dog, I would do 1 week for 4 and then start spacing it out. So could see you back in 2 weeks. And then as long as you're saying, yeah, no, I'm happy with that, he was maintaining everything between the last session and now, we just keep spacing it out. Some people just see me once every 2 or 3 months. Some people see me twice a year just as a check-in or a little make sure that the dog's not compensating, or that the original cause for them coming to me is okay and that everything's managed okay, basically.
Do you give food and exercise schedules for obese dogs?
Yeah, so food, exercise, yes, definitely. Food, I suppose that's why I'm getting the nutritionist in, because that's a huge conversation, and it's a huge, you need the support, I think, as well, depending on how long the dog's been obese. But I mean, yes, I mean, I can tell you about certain weight loss foods and different things like that, and where to cut out things. But definitely having a specialist to talk to you about that, I think, is really important, which is why I want to be able to offer that. Up to now, I've just been doing it myself, and it's worked fine. But there's just not enough time in I have an hour to kind of get through a lot of stuff with the owner. So yeah, I mean, getting them on a weight loss diet is probably step one. Even going through what the dog gets in a day treat wise, even if the owner can cut back to half of what they've been giving them, and then maybe a quarter of what they've been giving them, because a lot of it is just us, wanting to give a reward, and the dog most of the time doesn't care what the reward is, so like I've got dogs that come to the pool and their favorite treats are carrots or green beans, so yeah, so definitely it's if we can change it with the owner, then we definitely offer that.
Great. Would you recommend any particular treatments for physical conditioning of a young adolescent dog with no obvious health issues? So if a dog apparently is fit and healthy, is coming out of the puppy stage into the adolescent stage, is there any physical conditioning that is beneficial?
Well, I suppose again, it depends on the breed. It depends on different things like that. Very hard to say. I mean, do they mean like from a physio hydro point of view, or just general exercising?
I think general exercise and maintaining the
yeah. Again, if I haven't seen the dog, it would be kind of hard to say. But I mean, if there's no obvious injuries, then I would fire away.
For dogs that might show aggression with other dogs, how do you approach this to change their behavior?
Well, definitely would go to your vet first. Rule out any pain, any issues, underlying issues that are causing this dog to be aggressive. And again, the whole reason of getting a behaviorist in here, I did behavior training and things like that, and it's there's a lot to it. I mean, if it's just an associated aggression, like my shepherd, she hated white Bichon Frieses, hated them. Could not let her off in a park with one. and I don't know the reason behind that, but it was a management thing that I had to do. But yes, like getting a trainer on board that can actually work through these and set up safe situations where you can retrain your dog. But definitely ruling out any underlying pain is where I'd go first. I'd go to the vet, make sure that there's nothing wrong with this dog, and then I'd get a trainer on board and try and help re-educate that dog and reassociate other dogs with not being negative, not being negative associations.
Okay. What is your opinion on joint supplements in both youngsters and older dogs?
Oh, that's a great question. That comes up a lot. And actually that website, Canine Arthritis Management, they've done loads of research and kind of talks on that, because basically my massive take home thing from that would be you could spend a fortune on supplements, absolute fortune, and not all of them really do anything. It's all good marketing. If you were tight with money, omega-3s, because they are proven to actually improve joints and actually help with inflammation and things like that. Glucosamine and chondroitin, not enough studies done to say that they really do anything. I know in humans, we all use them a lot and think highly of them. In dogs, we don't really know that it actually is doing anything. It doesn't seem to be doing anything negative, but doesn't seem to be doing anything wonderful either. Green-lipped mussel is kind of a newish one on the market, and that seems to be really good as well. I actually did trial UMove Advanced 360 on Damon, my Labrador, and I can honestly say I did see an improvement in him. And both my parents did as well, and they wouldn't be as observant as I would be. Like, I'd be watching his every move, and they even noticed he was just getting up easier. He wasn't as lame, all the little things. But from supplements, the only ones I would really go for would be the omega-3s. And then you're looking at fish oils, which can be fatty. So again, if you're dealing with a dog that's overweight, you just need to be careful as to what you're adding into their diet. That's not going to cause them to put on weight as well, because any weight on bad joints is like adding fuel to a fire. So you're kind of, you want to do something good, but you end up doing something kind of, you're making the situation worse. Some dog foods claim that they have a lot of these things in them, mobility foods and things like that, so that you wouldn't be having to give extra supplements or be buying extra supplements. But yeah, the only ones that I probably would back would be omega-3s and green-lipped mussel. They'd be my ones.
And just one more. Does your dog have to be unwell to go and visit, or can they come for socialization?
They can 100% come for socialization. In fact, yeah, the sooner the better. I mean, I'm all about preventative rather than a cure. It's a great idea. And this is the thing, like, they end up absolutely loving this. Like, they love coming in. I have dogs who recognize their swimming bag, and go mental. And it's a lovely environment. Like, I would highly recommend starting your dog young. Actually, I can't claim that this is mine, but a woman in the UK calls it Paw Lattes, and it is. It's like us trying to you know, going to your Pilates class or your yoga class. It's to stay strong, and to you know, build up muscle and to feel better. So it's not about waiting, oh, my dog's really lame, I better go to the physio. You know, this is about preventing lameness and preventing any pain that you can, you know. And as I said, it doesn't have to be every week. It could just be like once every, you know, month or two or whatever, to help with your dog, for whatever reason, whether it be for maintaining muscle or for socialization or whatever.
And it's funny actually that came in, because I brought one of my youngsters to you for that last week.
That's why I was laughing. I was like, oh, this sounds familiar. Yeah. And that's the thing, he did so well, you know, when he, like, that, it's a big deal now, because obviously with COVID, people can't come in anymore. So they do have to leave their dog at the door, and the dog does have to kind of say, okay, I'm just, you know, and it is definitely so good for confidence. So good.
Yeah. And just so people, like, I bought a puppy who just turned 8 months old. It's because of COVID. He thinks people walk past him, not walk to him. So he's a little bit shy. And without breaking my conditions of my COVID restrictions, this was the only way I could get him with proper hands-on treatment, and away from me. So he wasn't relying on me. So he went for a session with Claire and he came out a different puppy.
He's fab.
He did.
He's
Yeah,
fab.
so
Leah was lucky to get the puppy back, to be honest.
So we don't have any more questions, Claire.
Okay.
Thank you so much for giving up your time. We really appreciate it.
My pleasure.
The webinar is recorded, so it'll be up over the next day or two on our website and on our YouTube channel for anybody to watch back who've missed it. Claire's details are up there online. You'll be able to get them again. If you need anything, contact her. And we'll see you again on the 6th of May for our iWebinar with Lisa.